So we have our mental health or emotional health and well-being, and then we have our physical health. But your mental health is basically how you're feeling emotionally. So most people, in fact, at some stage in their life will probably have some struggles with mental health. You may notice the physical symptoms of it, and that might be things like feeling tired, having headaches, physical symptoms of anxiety, feeling a bit shaky or breathless or racy heart. You might notice more the emotional or psychological features where you're feeling down or feeling anxious and worried, or you may notice the cognitive symptoms of it. So a good starting point is seeing a doctor, seeing a GP, and they can talk to you about what's going on, so they can assess you. Sometimes it's just a good talk that you need with someone to express how you're feeling and work through those things. But they can also help you with different things to do with your lifestyle that might help your mental health. They can put you in touch with other people who might be able to assist, whether that's a counsellor or psychologist or mental health social worker. They can advocate for you in terms of work or studies, and sometimes medication is helpful and they can help advise whether that would be useful or not.
So there's lots of different ways that you can define being healthy, and I guess that comes down to what it means to the individual, and we would tend to break things down into how they are biologically, physically, but also your social, environmental health, and then obviously a main one being your mental health. Social media would like to define that, your appearance is probably one of the most important factors of how we interpret or define health. But no, it's not the most important factor. By touching base with one of us, we would be able to go through and make sure that, we can individualise and tailor different programs or recommendations that's going to be sort of the best fit for you, the individual. Exercise and nutrition is probably the most important thing that you can do to optimise your own health and well-being. There's only so much that we can do, with medication and other sort of interventions, but what we find patients really benefit from is that this is something that they can, be autonomous with. We're also very lucky that we've got access to really good on-site resources, so both dietitians and exercise physiologists who can really, work out an individual program for yourself and to help you meet the goals that you're working towards.